TikTok live number 34. Let's go. October 2024. We're making moves. All right, let's get to the questions. Let's go. Gundy Mustafa just joined. What's up, friends? What's up, party people? I feel like Axwell. I don't know if you guys are fans of Swedish House Mafia, but he would always call everyone party people. What's up, party people? I'm a big Swedish House Mafia fan. Big Swedish House. I love their last song, Alicia Keys. Finally. Has anyone heard that one? The song is fire. Corker joined. Lance joined. J-Rock346 joined. Brooke Higgins, he joined. Kathy Chambers joined. Funk Chino said, how much do OS make? So in residency, I started out at $69,000 a year. After taxes, it was about 45 to 48. My rent was 34. So yeah, you're not making that much during residency. Now I'm in the 80s. I don't know where I am in the 80s, but better. That's it. The rent's still around 34, 35. So that helped me out a lot. But after, I already signed, but I was just talking to a lot of practices over the last actually year and a half. And I had mentioned this in one of the last TikTok videos. The lowest I've seen was like 280, 300 between like California, New York. These are base salaries. Remember, I don't know if you know what the difference is between a base salary and the percentage of collections, like what the practice collects from insurance, from the patients. That's collection, right? Not what you bill out. Collections is what you collect, and then you get a percentage of whatever the practice collects. Okay, that's percent of collections, and I saw anywhere between 28-40% of collections, and yeah. So I mean, I could go into that much more, but so base salary, I saw anywhere between like 300 up to 850 in like the Midwest, Wisconsin area, 700 in like the Colorado, like in the Midwest area. Okay, let's see. Blank said, how to, by the way, the top 3 longest listeners on the podcast, I give you a shout out in the podcast and the YouTube channel captions. Funkchina, I'm a dental assistant interested in becoming a dentist and maybe an oral surgeon. Do it, dude. Go for it. Definitely go for it. Let's go. Blank said, what did you get your 4-year degree in? 4-year degree, you mean undergrad? It was chemical biology, which is basically just biochem. They just needed to make their own fancy degree, right? Underscore also said, how to better crowded teeth without 5,000 and no Invisalign because they said it's too bad. I'm not sure. I mean, you got to go with braces or Invisalign if you want to get your teeth straightened out, right? Corn on Jacob. I said, I prefer Danish apartment mob. I like that. Danish apartment mob instead of Swedish house mob. It's Danish apartment mob. That's cute. That's a good one. That's corny. I like that. I'll go with it. How can I decide if I want to do general dentistry or OMFS? Well, I would spend as much time as you can viewing and observing what they do for a living, right? Does that make sense? See them in the clinic. See them in too much? Maybe that's good. Shadow them, observe them, see what they do, okay? Get a good idea of what they're doing every day, day in and day out. Keep going, keep shouting, keep observing them until you get an idea of which one do you feel more excited to be waking up on that next day. You know what I'm saying? Shadow them for 5 days, 10 days. Whichever one you'd be more excited to see on that 11th day, for example, that's what you go with. I think it's pretty simple. I think that's the best way to do it. Apple user 8393, craniofacial orthodontics thoughts. I don't understand craniofacial orthodontics. I don't, because craniofacial is all of this, right? Orthodontics, dontia is teeth, the dentistry, and ortho straightening, right? So I don't know. It like the concepts, the Latin behind it doesn't make sense to me. Maybe it's just because I didn't take Latin or Greek. True. Otherwise, like, I don't know. I don't know enough about it. I do know someone on LinkedIn who's a craniofacial orthodontist. I don't understand what that means, though. And I think they'd be working primarily in a hospital setting versus like in a practice where most orthodontists work. I don't know why you'd want to do that. But Funk Chino said, I'm interested in becoming a dentist. I'm a dental assistant right now. I'm 20. Do you think becoming an OS is worth it or stay at dentist? Look, dude, you got to figure out what you'd be happy with, what you'd be excited to do. I can't answer that for you. You got to do it. You got to explore it, explore all options, try and get into dental school first, right? That's usually a good place to start and go from there. All right. Funk Chino, just answer that. Michael, yo, Big Gallagher. What's up, Mike? How we doing? Blank said, how can I decide if I want to do general or OMFS? You got to observe. You got to get there in person. You got to watch them, assist them, shadow. And you got to do enough days where it's like, I really want to go back to the other one. That's how you know. That's it. Blank said, how can I decide if I want to do general or OMFS? How did you decide? That is how I decided. Dorian, do schools look down on community college prerequisites? I mean, if you went to, hopefully not, but the reality is that dental schools want to brag about who they selected their students from, right? And now it's not going to be 100%, but they love to say how many students they came from Ivy League schools in their class, right? They love to brag about how high of a GPA average they have, how high of a DAT score average that they accepted into their year. So that's something to keep in mind, right? Now, I do know students that came from community colleges in my dental school class. So don't count it out. Definitely not. And then also, if you're thinking about like a course here and there to fill in, like I took physics at Suffolk Community over there to fill that in, and like it didn't matter. Okay, that was Dorian Chidu. IMA7033 said tips for not getting burnt out in grad school. Well, try and stick with your everyday life. You know, like if you like to cook. If you like to do exercise, weightlifting, do weightlifting and exercise, right? Make sure you don't give up your entire life for that one thing. Make sure you're doing what you're happy doing, you know. And bottom line is, if you're not happy doing that, then I would reevaluate that, right? Like residency has had many ups and downs, a lot of downs, but you have to reevaluate as you go. And, you know, think there are things that you enjoy during residency, there are things that you don't enjoy during residency. And here I am making time to get on the podcast right now. We're talking about stuff. This is how I don't get burned out. Like, it's a lot of work. I'm going to post this and I'm going to go do my analysis. I'm going to go through it. Top 3 listeners, I give you guys a shout out in the captions of the podcast and on YouTube. Then I post it and stuff. It takes a lot of work, right? But I enjoy it. And I enjoy connecting with you guys like this. I enjoy, like, it's communication. That's what this is. Social media just isn't a bunch of negativity. No, there's a lot of positivity here. And anything I can answer to help you get closer to your goal, that's a win, right? That's a big win for you, and I enjoy doing it. So it's a win for me. It keeps me happy despite having a very rigorous residency schedule. Today is super light. So I was like, what the heck? Let's get on. Let's hop on the TikTok. Get on the pod a little bit, you know? Ian Radcliffe, follow the live creator. Thank you, Ian. Thank you, Ian. Next one is Tier, happy face. I need some motivation. Currently on a rough path. Gotcha. Do you have any movies that you like to watch that gets you out of that rut? I know I always like to rely on movies. I like to get a hard sweat. Go for a nice long run, hit the sauna maybe, do a nice run on the treadmill. I got to sweat out all the BS. Go and sweat it out and then get back to work. Get a nice hot meal, watch a movie, maybe a show, whatever keeps you motivated on the weekly basis, and get back to work. You know what I'm saying? Let me know what you think. Michael said, just took my biomed exam for the first year, gunning for OS. Well, don't gun for it, and don't compromise your personality. Be a good person. Be there for others. Remember teamwork. But good luck. Do it. Do it. Never ever 589 just got the #1 gifter badge. All right. All right. Never ever 589 sent a pumpkin head. Sweet. Happy October. Halloween's coming up. It's the 7th of October. User 7683. I'm a D1 and my grades are really bad. Do you think I could still specialize? Yes, you can still specialize. It's early. It's only October, dude. My first biochem exam was in October, believe it or not, in my dental school, right? And it didn't go too hot. But anyway, you could still do it. You could do it. Focus, readjust, work on self-awareness. See what you're interested in within the specialties and general dentistry, right? Work really hard, get good grades, and learn how to treat patients best. The highest score person, I would not necessarily, at least in my dental school, top 3 weren't necessarily the best at treating patients, right? Hand skills, patient interaction, and communication. These all go into it, right? So don't let that get you down. Don't let the grades get you down. Dentistry is a lot more than grades. All right? Good luck. Dorian Chidu, do schools look down on community college prerequisites? I answered that already. Juan Botero, 720. Shout out to Jacob Jacobo. Shout out to Jacob Jacobo! Yeah, that's awesome. KDS 2107. Can a wisdom tooth be used to make a bridge? I think what you're saying is, can a wisdom tooth be used to make a bridge? No. Generally, no. Have I seen it? I actually have. But no, generally, now what if it's a drifted wisdom tooth, right? It's migrated mesially. Maybe. Not usual. It's rare. Blank said, is your signed contract over or under 25K? Right about there, actually. Right about there. A little bit under for the first year. That's it for the second year. That's just base salary. I don't really care about the base salary. I don't. Like, I'm telling you, I don't. My biggest thing was percentage. A lot of the offers were offering 30%, some 35. The offer I got was 40. I'm not messing around. Literally, whatever I come out with after first year, regardless, I'm going to hit that base number. That's not my concern. The base salary is very important, right? Because everything you do, you get a percentage of. I wanted a higher percentage of that, right? Obviously. And the reason being is thinking about how much work I'm going to do. I'm already thinking like 8 to 5, start on Monday at 10 and at 7. This is kind of what I want to do, right? Squeeze a couple hours out of the week here and there. No weekends. I do not want to take no call. I will not take call. I will not take call. I can't stand it. Until hospitals actually want to pay their doctors and surgeons for taking call, then we can negotiate. Then we can talk about it, right? But at this time, hospitals are not doing it, and less are doing it. You could forget about me going into your hospital. I would love to help, but if you're not going to pay people for help, like someone's got to start talking about this stuff. Okay. And insurance companies are not reimbursing anything for care that was already rendered now. What is up with insurance companies now? They're supposed to pay for care that people, in treatment that people need. Anyway, I'll save that rant for another time. But yeah, so a percentage, think about it. The difference between 30 and 40% of an oral surgeon's salary is literally like 2 Teslas a year. So like, to put it into perspective, all right? And look, I'm not trying to get necessarily like a bunch of Teslas, a bunch of watches. I do like watches. I do want a Cybertruck because I think it's the safest thing on the road besides an ambulance, literally. And look, I want to be able to take my kids safely to and from school, soccer practice, grandma and grandpa's house, who knows? So yeah, that's how I think. That's why I want to get a Cybertruck. It's electric, better for the environment. I will have it more than 2 years, so it will pay back that it takes to do the lithium battery stuff, right? I don't know if you looked into that stuff for electric vehicles, but that's true. And it's a safe vehicle. Dude, it's awesome. So yeah, that's what I'm looking at. Just give me 1 second. So that's what we're looking at. That's what we're looking at, folks. All right, let's get back to it. What were your stats when you applied to dental school? My stats were about a 3.6 GPA. It was a 3.6 GPA average. Stevens Institute of Technology was where I graduated from. Chemical biology. I got a research award from undergrad. I played college in basketball. My DAT score was 22 of the PAT, 21 academic average. All right. Hope that helps. User 4349, D1 here. When would you recommend studying for the CBSC? How much time? So first of all, I would recommend listening to this podcast I did with Axe. It's called CBSC Dissection. Okay, that's got everything that you need in there. All right. When would I recommend start studying for it? I started studying for it. I actually took it after D1 year without studying for it. You need to get an idea of what the heck this test is that you're studying for, right? Before you really make that commitment, because it requires a lot of commitment and focus and sacrifice, unfortunately. Studied for it, and I took it after D2 year, okay? About 3 months to study for it. And then I took it for a third time. Second time studying for it was in the middle of D3 year. I only had about a month and a week to study for it, but that's when I got the score I really needed to feel comfortable applying. John Zent, current D3, starting to extract teeth. Any tips? Take your time, all right? Don't overwork it. You're not pulling out the tooth. Really work on elevating. I think the biggest thing with teeth is elevation, okay? Make sure the patient's numb and comfortable, obviously, before you begin there. Blank said, is your signed contract over under? Caroline, do any OMFS residency positions go unmatched, and how can those get filled? Yes, they do. They get filled by contacting your dental school coordinator, whoever the liaison is for, like, contacting residencies and getting an idea of who have unmatched spots, right? And keeping in contact with those residencies that you interview at so that they know you and let them know that, hey, well, I don't know. I guess you can't say, like, email the program coordinators and directors, and if they have any unmatched spots, then see what you could get there. You know what I mean? All right. Tiana said, I'd fall for this man in a heartbeat. Thanks, Tiana. I appreciate that. Kat Sosin said, hey, remember me? Oh my gosh, I do remember you. I'm pretty sure you deleted me on Instagram. Yeah, Kat Sosin, I do remember you. Yeah. You were a friend with the president of the dental class a year below me. You deleted me on Instagram. That's hilarious. That is really funny. We also met at that beer festival thing in Manhattan. That was awesome, by the way. Holy smokes. I don't know if you know this, but I'm a big beer festival fan. Big beer fan. I like to win beer chugging contests. I do. I'm competitive. I'm friendly competitive. You know what I mean? But hey, if you want to chug off, you want to shotgun, count me in, dude. I'll shotgun White Claws, or you let me know. Actually, here's a funny story. We were on a cruise my D1 year, and I went on with 2 of my other buddies in the dental school class. And on the trip, it was like our second day. We were like, let's do a chug off. All right, because we got the all you can drink package. And so what we did was, you know what the Foster's is? That big giant beer can. It's got 2 beers in it. I was like, all right, Brian, I'll race you. I'll chug the Foster's in the time that you chug Blue Moon. So he put his 1 glass Blue Moon into a glass, and I poured my Foster's into 2 glasses, and we literally tied, or I might have been. We'll call it a tie. Brian. But that was awesome. That was awesome. 7:02. Okay, I gotta go soon. Apple user 839. I just don't know. All right, Simran Singh, what's up, dude? What's up, Simran? I'm gonna have to refer you my Wizzy cases, my boy. I got you, dude. I got you, Simran. Balani Aloni, is it really that hard, really? The CBSE or dental school? Yeah, the CBSE stuff. The CBSE is hard. The average score is about a 55, to give you an idea. And then, yeah, here we go. Oh, wow. I just scrolled down and I missed a bunch of... Here we go. Okay. Zamber said, if you need to make a noise, I will use the big needle. If you make a noise, I will use the big needle. Oh, that's mean. Ellie Rofi, I really don't have any questions till now, so I just want to thank you so much for your content. Thanks, friend. I really appreciate that. I really appreciate that. Zamber said, such a good boy. Hope everything is going great in LIF. I'm not sure what that is. AA2 World, great seeing you. You may not remember me, but we record a podcast together. ML, what's up? Yeah, what's going on? What's going on? User said, what's your average daily production? So in residency, I have no idea what my daily production is. Cole said, what drew you more towards dental route instead of medical? Oh my God. Shadow some medical doctors and see how happy they are. And unfortunately, with the corporatization of dentistry, consolidation of jobs in dentistry that's following the trajectory that medicine took, the path that medicine took 20 years ago, dentists are becoming less happy than before. And generally, it was much less. It was mostly private practice when I shadowed the dentists, and they were all so much happier than the doctors that I knew. That's it. I want to be happy too one day. So that's why I went dentistry and not medicine. But we'll see how it turns out. I got another year. I graduate in about 9 months from oral surgery residency. And then from here, we will see how it goes out in private practice, right? Jay Lynn said, where did you get your rope bridge portrait in the back? I've seen it everywhere. Yeah. That's, what's it called? IKEA. That was a IKEA snag. That's what that was. Caroline. Good. Future Dr. Danny, should I go study for my resto exam? Yeah, probably a good idea. It depends on how comfortable you are and then how ready you are. Pre-dental. What's up, Luke? The podcast with Surgical Gourmet was one of the most entertaining I've listened to. Really? Let's go. Luke, you better not just be butter in my biscuit. You better is that the expression? You better not be brown nosing. You better not be buttering me up. I hope you really. What did you like about the podcast? What would you want me to go more into? I have a lot of fun with the podcast, right? We go on, we professionally screw around, we joke around, we chat. I don't know. Guys, I love podcasting. By the way, this is going on the podcast later. The top 3 longest listeners, I give you guys shout outs 1, 2, 3 in the caption of the podcast. YouTube, Spotify, Apple Music. Tyrese loves cats. Is it true OMFS residency causes a lot of divorce? Dude, divorce is like over 50% in the United States right now. I don't think it matters what residency or specialty or profession you're in right now, unfortunately, which is kind of scary, right? Xander said, I can be a really good dentist. You can be a really good dentist. Xander said, I'm starting with the needles and the drill. Okay, let's go. How's the difficulty level in dental school, senior in high school, thinking the dental route? Yeah, well, let's start with college first, right? I'm not sure where you are in the world right now, but in the United States, you got to do your 4 years of college, an undergrad, and then apply to dental school. Masari said, is getting with bad in undergrad bad? I'm not sure what you mean there. Don said, thoughts on Veneers guy who got charged with 8 felonies for practicing without a license? Yeah, that's illegal. My thoughts? Yeah, 8 felonies? He's literally hurting people, right? He's causing. We take an oath to do no harm to our patients, right? He didn't take an oath, and he's directly doing harm. Like, I don't know what you want to say. Tyrese loves cats. Is it true? OMFS residency goes underscore. What do you project your revenue will be for the first year? About 1.5 million? No, I don't know. I'm not giving a projection. That's way overdoing it. Your first 2 years out, it's very difficult to get over $1 million from what I've heard. Okay. And I'm not just trying to get out there and like make as much money as possible. I'm trying to develop a reputation. I'm trying to treat patients the right way, ethically, spending time with them. I'm trying to do good work. That's my focus, right? I think money will follow good work. I'm entirely focused on marketing. I'm entirely focused on letting people know that I'm in the area. I'm going to be out in Melville. I'll be in Melville on Long Island in New York. That's where I'm going to be. That's where I'm going to be practicing. Okay. So, I want to develop a good patient basis. I want to get in touch with other dentists and specialists in the area, in the community, and just grow and just see where it goes from there. You know what I mean? Future Dr. Donnie at Masari, I had a W and got admitted. Nice. Just have an explanation to give to your interviewers. Good. Tyrese loves caps. How to maintain relationship in OMFS residency. Well, you need to have this self-awareness to budget like what you need to do to graduate, right? And then taking time yourself, make sure that you're relaxed, you're getting through, you're happy, your own time to yourself ultimately. And then making sure, after that, a lot of that's going to tie into time with your significant other. And I think you should take that seriously. You really do need to take it seriously. Here, I'll give you another thing. Essentially, at the end of the day, your significant other in the home, the apartment, whatever it is, they're your rock, right? And at the end of every day, whether you're in residency, whether you're seeing friend, whatever you're doing, you're coming home to that rock, and that rock is what keeps you stable. So I would hope that you spend enough time in investing into your relationship. And before you're in a relationship, make sure you find the right one. They need to be a rock. They can't be paper or scissors. I don't know. I'm trying to relate it to like the flimsy stuff in rock, paper, scissors, right? The rock is your home base. That is your centerpiece. When you go home, they need to be able to not put more stress on you. They need to be able to help you out, and you need to be able to help them out too, right? That's what it's like. It's a collaboration. It's a teamwork. It's being able to, they're your counterpart. They're your ultimate. What's the word? 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 Your significant other is like the ultimate, like the missing piece. Whatever. All right. You should be focused on paying your loans. Xander, that's what you just said. So Xander says you should be focused on paying your loans. I don't know. Like, if you focus on paying your loans and put all your early money into paying those loans when you're allowed to do like all over time, how are you going to buy into a practice? How are you going to buy a car? How are you going to buy a practice? I don't know what the answer is yet for that. Does that make sense? I don't know. I don't know if that's the answer. 933, the batteries explode. I don't know. What do you mean the batteries are what? Masari is getting W during undergrad withdrawn. I think I dropped it. Physics 1. So it was like literally 2 exams. It was a midterm and a final, and both were 10 questions. So I got 6 out of 10 right on the midterm. That's a 6. Oh, no, wait. 4 out of 10 right on my physics midterm. I dropped that class. No way. No way. I'm not ending up. Because if you get a 40 and then you have a final that's the other 50% of the grade. If I get 100, that's still, what is that, like a 70? That's still a C. I'm not doing that. Forget it. I dropped it. I moved on. Xander said, make Elon Musk richer. I think you're saying make Elon Musk richer. And dude, Elon's earned all of that. So I don't mess with Elon. The guy's getting rockets in space and then having them land on a little raft in the middle of the ocean. I've seen it happen. Like that's incredible. In addition to everything else that he's doing, the guy's a genius. All right, I have the utmost respect for Elon, and I think every single piece of content, the speeches that he has online, I think it's probably a good idea to listen to what he's saying because he knows a lot more than us. Just that simple, right? He knows more than me. I want to learn from some of them, like the most smart people, and it's all online. All these podcasts, these speeches, it's all online. It's free. We could. Why wouldn't we be listening to that and be listening to like a teacher in your high school or college that's like putting you down? You know what I'm saying? And everyone's listening to that. If they put you down or they're telling you need to readjust your grades or something, readjust your course into like your career, I would much rather listen to the smartest people in the world on podcasts, YouTube and stuff, their speeches, rather than listening to a teacher that's putting you down that isn't investing into you necessarily, right? Person with the money for the lips and 2 eyes, any concerns for the future of single degree OMFS managing their own anesthesia in private practice? Why would that be a concern to me? It would be a concern for all oral surgeons. It's not just single degree. Why would a double degree who has the same amount of time on anesthesia as a single degree have any different in concern? Make sense? Ayuda Gabagidadi said, I thought it was Hunter from Grey's Anatomy or Owen Hunt. User 7683, what was your least favorite class in dental school? Xander said, as all memorization should be super easy. Maybe. I mean, I like to use Quizlet. That's how I learn stuff. Drizzy Burner, could they see your past results? Past results in what? Tyrese Loves Cat said, how to maintain a relationship on OMFS residency. Yep. Ahmed Ehab, can you do rhinoplasty as maxillofacial surgeon with BDS only? BDS only? I don't know. BDS, they can't practice outside of an institution in the United States. So that's something to keep in mind. User 7683, when did you make time to study for the CBSC when you didn't have class? That exactly when I didn't have class. Sometimes I'd even study in class. Thanos said, have you ever farted during surgery? I don't know. I can't remember. I can't think of any time. I don't think so. I don't know. That's a good question. Tyrese Loves Cats. How do you maintain a relationship in OMFS residency? Yep, I mentioned that. Yu-Gi-Oh! 1500 New York City. I got cheated on in 2017 and made a promise I'd never fall in love again. Been kind of lonely since, though. My man, I'm sorry to hear that. You think it's cool if I started dating again? Yeah, man. Get on those apps. Get on those apps, dude. Get on the apps. Meet people. Be respectful, right? And meet people, have fun, network, right? Do social media. I don't know. I find that stuff fun. Up to you. Caroline, do OMFS... Oh, wow. We got a lot of questions to get to here. Holy smokes. Do OMFS residencies give you any insight on how high to rank them based on your interview? Sometimes they do, sometimes they don't. They're not really allowed to give you any insight on where they're ranking you. Future Dr. Downey, any tips on maintaining romantic relationships through dental school? Yeah, keep it romantic, A tip that someone else gave me, actually, is that try and spend once in a month, go on a date with that person, whether it's dental school, whether it's residency. Once a month, you can make that time. Go out to dinner, go out and eat, go do your favorite thing to do together. That's a really important idea. Keep it romantic that way. Open up a bottle of wine, watch your favorite show, movie, at least once a month. Got to do it. Mazzari said, is getting W undergrad bad? No, not necessarily. Yu-Gi-Oh! 1500 shotgunning White Claws isn't exactly comforting when you have 5 different tools in my mouth. They do not go hand in hand. That's completely different. But thanks for twisting it. Yu-Gi-Oh! 1500 University, my friend's family donated a lot to NYU, and they gave him a dental degree. Andrew Nowak 552, thanks for talking at my school in Poland. Love your stuff. Andrew, what's up, man? Thank you for your kind words. And of course, dude, any other events, you let me know. Anything I can help you out with, just DM me on Instagram, LinkedIn. Those are my 2 primary platforms right now, I would say. Esco said, how's the difficulty level in dental school, senior in high school, thinking of the dental route? It's difficult. It's like the equivalent of like 32 credits a semester, they say, dental school. Yeah. And then undergrad is like 15 to 20 credits a semester. So it's a lot. Aaron said, it's either Aaron or Aaron. D1's shadowing at Bellevue, not seen often, even if I have years experience in OS. How should I get OPP? Get OPP? I'm not following. 313 said, wait, is there any sound or is the problem from my TikTok? Guys, you can hear me, right? You can hear me just fine, right? Jersey Burner, what CBSC percentile do you need to be at, have a good chance at matching? I mean, try and get that 70, 75 or higher, right, to be a strong applicant. But even if you don't hit that and you hit a little bit low, it's just fine. Ryan Bayers, I'm in med school, girlfriend in dental, thinking about OMFS. Any tips with trying to match in a similar area? Yeah, you could do the couples match on the match portal that you submit. You could put in someone else and you could like try and match together. Yeah. Henry Dentistry, Jim Turtle, EQ. I'm a D1 trying to specialize. Any advice on getting into OMFS? Thank you. Yes. Listen to the CBSC dissection podcast I did with Axe. It was like back in March. It's got everything you need to prepare for the CBSC. Okay. And we also have tips on there and insight, as well as the interview one we just did last week. That's Dose of Dental podcast number 106. There's some stuff on applying, interviews, CBSC studying. Everything's in there. All right. Billy Horror, HORR, said, how do I fix my TMJ? Well, go to a TMJ specialist, get a consultation, let them give you the full evaluation. That's the best place to start. I can't fix your TMJ through TikTok Live. Ruben, GOD, how hard is it to pass the USMLE 2 and IMG? I don't know what an IMG is. USMLE is serious, though. It can be tough. Billy, HOR, follow the live creator. Thank you, Billy. Megan said, do you work with PAs? Yep. Yes, Megan. We work with PAs. PAs are awesome. Jersey Burner said, what CBSC percentile do you need? Billy, HOR, said, where did you go to dental school? I went to Stony Brook Dental School. Lemor Ra said, what was your DAT score? My DAT score was a 21 academic average with a 22 PAT. Jersey Burner, how is the work-life balance in OMFS? Well, this year, chief year so far, and it gets really busy in 2 weeks now. For 2 months, like a super busy 2 weeks, 2 months. It's been great up until now. I got to be honest. Like right now, I've been very lucky and fortunate up until now. Esco, follow the live creator. Thanks, Esco. Tyrese loves cats. How do you maintain a relationship? So that one. Jersey Burner Lamara, he said 22. Lamara said, are you doing the 4 or 6 year residency route? I'm in the 4-year route. 2 years extra for the MD. I didn't think. You don't do different surgeries. You don't make more money doing the extra 2 years. So I'm like, what? Why would I do it? Megan said, do you work with PS? Yep. Eric Newen, any tips or tricks for ranking my residency match list coming up? Yeah, like envision yourself where you want to be, where you'd be most excited to wake up and go for the next 4 to 6 years, or wherever, specialty, whatever residency or general dentistry that you're looking. Think about where you're going to be most excited. It comes down to location in proximity to cities, family, friends, significant others, stuff like that. Okay. Good. Agent Lee, compliment. Jojo, what is your best dental school interview advice? How to prepare? I just did a 106. This is podcast Dose of Dental podcast 106. I just did with Axe. I gave all my insight and mentoring to him for interviews. In that podcast, I would check that out. It's on YouTube podcasts and stuff. AQ 2024. How about you put Israel flag in your bio and support Israel first? God's chosen. Yeah, I do support. Everyone. I do support Israel as well. Janelle Kelso, how do you feel about general dentists using CBCT technology? Yeah, it's great. Why not? Bios Creations, who has more authority, attending or chief resident? Attending, 100%. A chief resident is just the highest level resident. Attending is the boss. Stephanie Miller, what's up, Stephanie? What's your favorite surgery? Right now, I'm liking all-on-X cases. I'm really liking all-on-X cases. I always love a good, difficult wisdom tooth getting out. Sedations are fun. Sedations are good. Sedations can be, they can really put you on the edge of your seat sometimes. But all-on-X cases, implants, I'm really liking those. And I like dental alveolar stuff. in oral surgery. Momene, what do you think about orophacial pain TMJ specialty? Well, it's definitely unique. It's definitely its own niche, if you will. User 14716 got an interview for dental school in months. Tips, congrats. My only interview so far. Dude, it's early. It's early. Excellent. Congrats. It's only October 7th. You'll be good. Any tips? Yeah, listen to the podcast I did with Axe on interviewing. It's got everything you need in there, from the interviewing conversation with the interview, how to do your rank, like everything's in there. Aaron, opportunity, there was a word limit, lol. Basharat Khan, is organic chemistry useful in residency? No, it is not useful in residency, although I did love organic chemistry. Basharat Khan, PharmD, wanted to go to apply to med school. Can you give some pointers? Yeah, I mean, really look into it. Before you do that, really look into it. Observe and shadow a lot of hours at doctors' offices. See if you really want to do that. All right, guys, I gotta get to a workout. Couple more questions here. Ozzy baby, hey doc, did you always know you wanted to go to OMFS? Top 2 pros and cons so far. It's a long residency, and the residency is not very kind to its people sometimes. It's a lot. Lexi Marie, follow the live creator. Thank you, Lexi Marie. Cons, that's the con. Pros, it's a lot of fun. It's exciting. I really enjoy oral surgery. I do enjoy oral surgery. The residency experience, but that is how it is. Kobe Florence, what are you doing your residency for? Oral maxillofacial surgery. Stephanie Miller answered that one. Good. Evan, I'm an M3 applying ENT. Sometimes I wish I had done OMFS. Any thoughts? Yeah, ENT is good, but I'm definitely happy I'm in OMFS and not in ENT. Scott Tarbett, would you be willing to speak at a dental school club event? Absolutely, Scott. Scott, DM me on Instagram, and we'll set it up through there. Okay. Anything I can do to help you, let me know. All right, let's make it a good event. The Real Katana Boys, what's your estimated salary? I mean, it's very variable. It depends on where you work. It depends on insurance reimbursement rates. It depends on, are you PPO or fee for service? It depends on how many days you're working. It depends on what your contract is involved as far as like percentage wise, base salary and whatnot. There's a lot involved. Sorry, we had a patient today where their implant unscrewed itself. I guess it didn't osteointegrate, huh? Sam Lord said, have you ever had a schizophrenic patient? Yeah, we have them like every day over here. Do you know where we are? I can't talk about it, but yeah, like literally every day, like today. Annette Miller, I just realized I want to go to dental school at 30. Do it. Don't let age is just a number, right? Older the wine, older the violin, sweeter the music, right? Billy HOR, how do I fix my TMJ? Go to a special, get a full comprehensive evaluation of x-rays. They might do a functional MRI. It really depends on where you are. Is it myofascial pain? Is it a functional deformity or condition? You got to get a full evaluation. This isn't something we can do through TikTok. Mike Sanchez, I need braces. Orthodontist. The Real Katana Boys, if you ever in Miami, go to Katana. I will. If you could get me in, where is Katana? I'll have to look that up. 313, can maxillofacial surgeon do face transplants? Yeah. In fact, it's a plastic / oral surgeon at the institution over here who does face transplants. Yeah. He's actually an oral surgeon. Billy HOR, which kind of doctor? Oral surgeons do TMJ. Oral surgeons do go to a TMJ specialist. Oral surgery is just fine. Yep, they have them. And at Miller, how often do you place implants? Also, what brand of implants do you use? Well, I'll wait for a sponsorship or a partnership. But generally right now, I like Nobel and BioHorizons. Yeah. How often do we place implants? Well, it depends on what rotation we're on. That unfortunately does. Real Katana Boys, follow the live creator. Thanks, Real Katana Boys. What's up? Billy HOR, you're 100% on fire. Thank you, friend. Thank you, Billy. Yep. Get that TMJ looked at. Okay. There's a big evaluation. It might take more than one visit. Let them do their thing, and it will help, okay? It might be something as small as like trying on a night guard, doing some ibuprofen, up to as much as a full joint replacement, right? But you need to start with that eval so that they can get to know you and they can monitor through the stuff. The Real Katana Boys, how that TikTok money though? I don't do endorsements or sponsorships. I'm not doing anything like that. I'm not getting any money for my social media right now. I'm letting you know, I don't do that. I do this just, I don't know. I want to be genuine. I'm not doing this to make money on social media. I'm doing this. I have side companies. We do it for that. I'm also like, I want to help people and I love podcasting. I want to hopefully have a nice podcast one day. You know what I mean? Brands can influence me. I don't want to give people false information that I don't believe in. I'm never going to recommend something that I don't believe in myself. And I'm not going to, a lot of these brands too, they're getting such free marketing. I'm not going to be doing free marketing for these people. They got to pay up, and I'm not going to be taking money for some BS. You know what I mean? I'm not doing that. 313 says, bro is an OMFS legend. Appreciate it. I appreciate that, 313. Renee J became the number 2 member on the team. Wow. Congrats, Renee. Hello to you too. Ennett Miller, which state are you in? I'm in New York. OMXR__F. What's the pathway to becoming an OMFS in the States? Are you dual qualified med and dentistry? Technically, yes, even without the MD. And the pathway, 4 years of undergrad, 4 years of dental school, and then 4 or 6 years of oral surgery residency. All right, friends, that's it. I'm gonna wrap it up. I gotta go get a workout in. Gotta hit these legs. My butt's getting flat. We gotta we gotta get that up. All right, friends.